these turned out to be congenital hemangiomas, and we were so desperate to we actually used leeches on them, medical grade leeches. You can buy them on the internet, of course you can. What really seemed to help, our leeches weren't hungry, so they didn't do too much except give us a couple good pictures. But intralesional triamcinolone is what got this better. It had hemangiomas on the eyelid, on the nasal, inside the nose, on the inside of the lip, all in the same side. And so it's kind of an interesting thing, but haven't seen one since. This was 1999. Just one last thing to mention about tarsorrhaphies, temporarily suturing the lid shut. And there is something I've wondered about for a long time. When a horse is painful, what do? They do a tarsorrhaphy on themselves, right? They squint. And yet things sometimes progress despite the squinting, don't they? If you increase the if you have an ulcer, a corneal ulcer, and you increase the contact between the eyelid conjunctiva and the ulcer surface, what you're doing is putting blood vessels in the conjunctiva adjacent to the ulcer. The ulcer is emitting the damaged tissue, and the ulcer is emitting cytokines, which are causing recruitment of neutrophils. And it seems like doing a tarsorrhaphy is making it easier for the neutrophils to leave the blood vessels in the lid and just move into the cornea.